What is stem cell therapy for Parkinson's disease? Imagine a treatment that could help replace the brain cells lost in Parkinson's disease. That's what stem cell therapy aims to do. It is still experimental but offers hope for future treatment options. Parkinson's disease is caused by the gradual loss of dopamine-producing neurons in a part of the brain called the midbrain. This loss leads to symptoms like tremors, stiffness, slow movements, and balance issues. Current treatments mainly focus on managing symptoms, but they do not stop the disease from progressing. Stem cell therapy seeks to address this by replacing the damaged or lost neurons with new, healthy ones. These new cells are derived from stem cells, which are special cells capable of developing into different types of cells in the body. In this case, the goal is to turn stem cells into dopamine-producing neurons. Researchers use two main sources of stem cells for this purpose. One is induced pluripotent stem cells, which are reprogrammed from the patient's own blood or skin cells. The other is embryonic stem cells, which come from early-stage embryos. Using a patient's own cells can reduce the risk of immune rejection, meaning the body is less likely to attack the transplanted cells. On the other hand, donor-derived stem cells can be produced in larger quantities but may requiring medications to prevent rejection. The process involves differentiating these stem cells into dopamine neurons in the lab and then transplanting them into the patient's brain. The hope is that these new neurons will integrate into the brain tissue, produce dopamine, and improve motor symptoms. Recent clinical trials have shown promising early results. In some studies, patients have undergone transplantation of stem cell-derived dopamine neurons and experienced improvements in tremors and movement. These trials also indicate that the procedure is generally safe, with no serious adverse effects reported so far. For example, institutions like Mass General Brigham and Memorial Sloan Kettering have conducted studies where the transplanted cells survived and connected with the existing brain tissue. However, it is important to remember that stem cell therapy for Parkinson's is still in the research phase. Larger and longer-term studies are needed to determine how effective it truly is and how long the benefits might last. Researchers are also studying potential risks, such as unwanted cell growth or immune reactions. Currently, stem cell therapy is not approved as a standard treatment and should only be considered within clinical trials or under medical supervision. In the future, this approach could become a way to not only manage symptoms, but also potentially repair the brain damage caused by Parkinson's disease. But for now, it remains a promising area of research. If you or someone you know is interested, it's best to consult with healthcare professionals and consider participating in clinical trials that are exploring these innovative treatments. Overall, stem cell therapy represents a fascinating step toward regenerative medicine for neurodegenerative diseases, with ongoing studies helping us understand its full potential and limitations.